Hello, and welcome back to the training program for researching the cost of iNTS treatment in government health facilities. I'm Win Morgan, and I will be your presenter for this session. In this session, we will review how to input data you have collected into the iNTS costing tool. We will cover how to input setup data, case counts, treatment procedures, procedure costs, equipment specifications, prices, and quantities. The first step of inputting data is to navigate to Step 1, the Setup worksheet in your iNTS Cost of Illness tool. There will be 7 input areas in this worksheet. Some will have been pre-filled, but you can modify any of them. First, you should enter a geographical area name of the area where you're applying the tool. You may use any name, such as a country, region, or a unique location. This name will be automatically included in the name of the tool on the top left-hand corner of each worksheet. It won't affect any of the other model calculations. Second, you can put in a scenario name. That's a unique name to the scenario you're creating in this copy of the tool. You may use any name such as baseline, optimistic, alternative, or other one to describe your scenario. The name will automatically be included in the name of your tool. It will not affect any of the model calculations. Third, in step 1C, we have pre-filled that this is going to be a retrospective costing for your entering of data into this copy of the tool. That means you're looking back on what has already been done and entering the data that you've collected. You can also do a cost projection later on, assuming that you want to do this, and that perspective you choose will automatically be included in the name of the tool. And it will be used to guide you to the proper place in the tool to count cases in step 4, which we will go over later. Next, you should put in your currencies and exchange rates for the year that you collected the data. United States dollars is the default currency for international currency, and then for local currency unit, you should change that to the country in which you are working, and you should include the abbreviation for that country's currency. For the baseline exchange rate, you should put in the number of local currency units to 1 US dollar and the year that that exchange rate was being used. We suggest that you use the UN operational exchange rates for compatibility with other studies. If you type into a search engine UN operational exchange rates, that will give you the website where you can get all of that data. The next thing you will want to do is put in the iNTS case types. We pre-filled those for you so that they will be comparable to other countries who are doing this same kind of analysis. We have 4 types of case types. One is the disease severity type. The second is the confirmed type. The third is the patient age range type. And the fourth is the drug sensitivity type. As you can see, we have 3 disease severity types. The first is non-complicated, and that's for cases treated on an outpatient basis. The second is severe, a non-surgical case, and this is for cases treated on an inpatient basis without surgery. The third is an iNTS severe case where surgery is required. And this is for cases requiring surgical interventions for draining abscesses and other problems. For confirmed type, we have 2 types, either confirmed or unconfirmed. And in this case, confirmation requires that a record of confirmation by blood test, tissue histology, or surgeon declaration is provided. Unconfirmed would be anything that does not have a record of that type of confirmation. The fourth case type is divided by patient age. We have 3+ years old, and we have under 3 years old. The drug sensitivity type is the next one, and we have fully sensitive. That's for those cases which respond to the first-line drug of choice. And the second is multi-drug resistant, and that's those that require a second round of drugs. After the case types have been input, we also want to input the procedure types for the types of treatment and initial procedures that will be used for this analysis. We've pre-filled this for you so that you can have comparison among the different countries that you're going to be working in. We start with the initial procedures. There's 2 of them. You have an outpatient comprehensive exam and an inpatient intake. Each of these are standard patient exams for suspected uncomplicated or suspected complicated iNTS cases. For treatment procedures, we have a first-line antimicrobial dose, and we have that both for people who are 3 years and older and those who are under 3 years old. And secondly, we have a second line of antimicrobials. That's when the first line of antimicrobials don't work. And we also have that for those who are 3+ years old and those who are under 3 years of age. We have inpatient resuscitative care, which does not require surgery. And that's a standard procedure for all who are admitted cases without surgery. And then we have inpatient intensive care with surgery preparation, surgery for abscess drainage or other major complication, and then inpatient intensive care post-operative. The final step for step 1 is setting up equipment set types. We have up to 5 different equipment set types, and those are already pre-filled for you. These equipment sets are those equipment that need to be used to complete the treatment procedures that were mentioned in the previous sheet. We have outpatient, which includes any special equipment required to conduct outpatient clinical exams for suspected iNTS. We have laboratory equipment that includes special equipment required to conduct laboratory diagnostic procedures. We have basic inpatient equipment that includes any special equipment that's required to intake a patient for suspected complicated iNTS. We also have radiology, that's special equipment that's required to conduct any ultrasound and X-ray diagnostic procedures. And we also have a surgery department equipment that includes any special equipment that's required to conduct surgical procedures for complicated iNTS. So you can cost up to 5 equipment sets. Generally, one is for each department, such as outpatient lab, inpatient ward, radiology, and surgery. Later in the tool, you'll be able to list the equipment that is included in each set, and you'll also be able to allocate the proportion of time that an equipment set is used for diagnosing and or treating iNTS. This will help you to avoid overestimating costs. That's it for step 1. We'll go on to step 2 in the next video.